Hello, everyone, and welcome to episode 4 of Divas Who Listen. I'm Bella,
I'm Miranda.
and today we are going to be sharing some of our own stories that have to do with the amount of time it can take to get a diagnosis and feeling gaslit by doctors. So, you know the drill. If you guys have any stories that you would like us to read on this podcast and share them, please go to the investigator's profile and you can find the link to submit stories there, or you can email them to investigator@gmail.com. But we are excited to talk to you again. So we're going to start with Miranda. Can you tell us about a time that you struggled with getting a diagnosis for something?
So, oh gosh, how long ago do you think this was? Were we in college when I had the foot thing? We were both in the boot.
So it was like 8 years ago.
Yeah. I don't think my body had ever walked that much ever.
Yeah.
Not even in Disneyland. Like Disneyland, I'll feel sore for a couple days, but after that, like I feel after Europe, I don't think my feet were ever the same.
Same.
But like I noticed that like when I was stepping, it just hurt so bad. And at first they thought I had I'm gonna mess up how you say this. Is
Okay.
it plantar fasciitis?
Fasciitis. Yeah. Close enough.
Fasciitis, that almost. That's why they pay the professionals the big bucks. They thought it was that, but it didn't seem right because I know people wake up with like a tingling with that. There's different symptoms, but I just, when I looked it up myself, I was like, I don't think that's what I'm feeling. It just feels like hurtful to walk around. So for like a month, I just dealt with it because I thought it would go away. And then I finally went to, I think it was a podiatrist.
Yes. I remember that.
King. But anyway, I went to a podiatrist finally after like a month and a half or 2 months of pain. And he did a scan. I think they even did what's the more invasive one? Like a CT. Yeah, I have the memory of a flea, and this was 9 to 10 years ago, so bear with me. After that, we really couldn't see anything wrong. Like literally see. It was hard. It was so in there that we couldn't really see that well. So we decided to boot it up for 6 weeks, I think. And people don't talk about how difficult it is to be in a boot on your driving leg enough, because that stops you from doing a lot of stuff. And like even just the pain of getting in the car, take off the boot, put on, well, if you put on a shoe, you should put on a shoe because it's legal to drive without shoes, I learned.
Yes, it is.
Yeah, I looked it up. Okay, I didn't get like pulled over.
She did not learn the hard way.
I didn't. I had like some pantuflas in there that I'd switch into, but like that was such a pain in the butt going to work because you had to like factor that in.
And do all the straps on the boot.
Yes. And then they get all loose. It's just a real pain. But like I had some comfort. It was more bearable, I guess. We did physical therapy. And I was telling Bella I loved my physical therapy because they would do like massages on it. They would put the lidocaine on it for me. It was fantastic. I would go back again, 10 out of 10. But like I still didn't know. When people would ask me, what's wrong? Why are you in the boot? I was like, I don't know. Like, I don't know.
Mm-hmm.
And my doctor was great. He was so patient with me. But then we went back 6 weeks later, and when we did like the little walking test, it still hurt. So then he was like, well, what do you want to do? Do you want to keep the boot, or do you want to cast it? Because, of course, casting is going to immobilize it more.
Yeah.
And I was like, I don't know. I don't want to feel pain when I walk anymore. So we decided to cast it. Cast? Oh,
I've actually never had one.
I just thought about that. They aren't fun. Showering? Oof. My second time with the cast.
Like, especially if you have sensitive skin, I imagine it's not fun. Like, I just know, even when I have something's not wrapped, but it's like there's tape or something, the itchiness and irritation that my skin gets, like, it drives me up the wall. I want to crawl out of my body because it just is a lot. And even like sweating under there, so I could never imagine a cast.
It's so weird. And you know what was crazy? I wonder if Sarah's going to listen to this. Is that I thought they covered your entire foot. They leave your toes out of the cast. At least where I got it done. Both times they've left the toes out. I didn't realize how like dry your feet get in general with the cast, because like it's always covered when you're in the shower or whatever. And I'd put lotion, but they get so dry. And then when you take it off, oh my god, a travesty. So after the cast, it did feel better. Every now and then, to this day, I can still feel like a slight pain depending on like my level of activity. Like for instance, on Friday, I went to a One Direction night, and when I took off my shoes and I was putting on my Crocs, I was like, oh, there it is. So every now and then it'll come back, but still, when I like tell the doctor it hurts, I'm like, I don't really know exactly what hurts. I just know that when I press on the front of my foot at a certain angle or after a certain amount of activity, it hurts a little bit. But it's not like the biggest problem anymore. If it is, like, I do the usual elevation or I try to ice it for a little bit, and that
Yeah.
seems to do the trick. So who knows if it was like my bone or if it was like the nerve. I don't think it was the nerve, because I feel like that would have been way more painful.
That's so weird that you have all this pain and can't even walk on it and do all this treatment and still like nothing could be found. And I know is it frustrating to not have an answer?
Yeah, I think more so like when I get asked, like, what's wrong with it? I was like, I don't know, it hurts, you know?
I think it helped that you had a doctor who was still willing to try taking care of it and treating it even without finding like an actual cause for the foot pain.
He was the best. I will still see him to this day, like every now and then.
For your foot or
For my foot, yeah. Well, for the other foot. But that's another story,
that's a
neither
whole
here nor
other
there. It's a
podcast.
whole other one. You
Your
guys, I can do a whole podcast just on my freaking feet
and your knees.
and my knees. But yeah, I think just thank God he was very patient with me, willing to listen, and he did the best he could to try to get me out of the gray area, you know?
Yeah. At least you tried. Like you can say that, we did all these tests and it wasn't anything serious, but you could at least try to get different like ways of managing it.
Oh, yeah. And even that helped tremendously. So I think if I felt frustrated with my foot pain, which was manageable, I can't imagine what it was like for you getting your diagnosis with VEDS.
I want to say it's common for people who have VEDS or related conditions to take a long time to get diagnosed, especially if they haven't had a major symptom like an artery dissection or a colon perforation. If they just have small clues, like it's hard to push for a diagnosis because it is a rare disease. So for anybody who doesn't know, I have VEDS, which is vascular Ehlers-Danlos syndrome, VEDS for short, VEDS, and it's something that as a patient, like, and my mom as a caregiver, we've always had to teach doctors about. I didn't really myself go through the feelings of how long it took to get a diagnosis, but my mom did because she knew when I was an infant, a toddler, that something was wrong with me. She had two kids before me, and she knew that I was a little bit different because my veins would show like on my abdomen and my legs. They were visible. I had thin skin. I would bruise easily for no reason. And my mom tried to bring this up to my pediatrician, and he was like, well, toddlers bruise. Like, they run into things. They're everywhere. They're tornadoes. Like, they are bound to get injured because they're exploring. They're getting used to their bodies. And my mom was like, well, you don't get it. Like, she is calm. So I was just like a chill kid. Like, I would just be like, tired since day one.
Hopped out the womb. I'm done.
Put me back in, coach. She didn't find an answer, right? So it wasn't until I was 5 years old, and I don't remember if it was something that happened. Like, I got an injury that was kind of unusual, but my mom brought it up to my pediatrician again. She was like, something's not right. So what's the word? He obliged, I guess,
Yeah.
and he ordered blood work, and my blood work came back a little bit abnormal. So
Right.
because of that, he referred my mom me to a hematologist, which is a doctor who studies or diagnoses like bleeding disorders or blood clotting problems, basically, to try to get an answer for my bruising. And so the hematologist, I guess, I don't know if they did more tests or they reviewed my blood work, but I was diagnosed with von Willebrand syndrome, which is a bleeding disorder, meaning that my blood doesn't clot like it's supposed to. So when you get like an injury in your vascular system, your system automatically starts to clot it up and patch it to fix it.
Right.
It's like an internal band-aid that it puts on.
The scab, right?
Yeah, but internally to cover the vein that bruised that opened. So like in a normal
Ah.
person, that's what platelets do. They're just like band-aids. They patch it up, that way it stops it from, it lets it heal, right? And stops it from bleeding more. But for me, with von Willebrand's, my band-aid was faulty. So it would take a long time to actually put the band-aid on there or even build a strong band-aid. So I would bleed more than a normal person, like
Right.
longer or more prolonged, have worse bruises. So that kind of answered like the easy bruising part of it, right? But for years, still, my mom was like, still something's not right, because even then, my skin would tear easily, and it just like all these things weren't adding up. And she even thought like, for me having a bleeding disorder, I didn't bleed as much as you would think for a person who should be bleeding more, right? Because von
Right.
Willebrand, people who have it, they're at high risk for internal bleeding, like pretty serious. And so it wasn't until I was 10, so this is literally 10 years later, 5 years from the von Willebrand's diagnosis, I was walking like it was in a dugout at a park for Easter, and I was walking on a little bench next to the chain link fence, and I
Yeah.
slid off the bench, and my knee, like, I guess, I don't know, I remember if it hit the fence or it slid down the fence. So what should have been a scrape in a normal
Yeah.
person, if anything, my knee split open. Like I had to go to the emergency room and get stitches. And so my
Oh my
mom was
God.
like, this is not right. And I think anybody could see that.
Yeah.
How would that cause such a like drastic like cut, or wound? Um, you know, Not just my personality is dramatic, but my body is. And so after that, my mom told my hematologist, like, we need to do more testing. And after that, he didn't tell us what he was looking for, but he did what's called a skin biopsy. So he took like a little piece of the skin from my shin and sent it off to a lab at the University of Washington, and that's when
Oh
it
my
came
God.
back positive for VEDS. Yep. So it took all of that to get the diagnosis that we needed, that my mom knew that I had something. And if it wasn't for her pushing and for us to have a doctor who was willing to do further testing, I would not have
Yeah.
gotten the diagnosis until something major happened down the line.
That is nuts. Do you remember when they did the skin sample?
I don't remember. My mom said that it was hurting me, that I was feeling it, because apparently we don't, people with VEDS sometimes don't numb as easily as the general population. So we might need
I
like
didn't know that.
extra anesthesia,
Mm-hmm.
which we knew from, well, after that we knew like when I had to get dental work done, I was feeling everything, and I started hyperventilating, so they had to put extra anesthesia there. And even when I got the stitches for my knee when it split open, I was feeling it. And the doctors, kind of going to the gaslighting topic of this podcast, they said that I was being like a dramatic child, saying that I was feeling everything, but I actually was. So
Wow.
I do remember that when the results came back and we had the follow up appointment with my doctor, I knew it was something serious, because I mean, I was 10, but I still
Right.
felt like the energy, the vibes that were going around. Like, if I was into crystals, I would have been like, you know. And I just remember they put me into a room where there were like toys, and the doctor took my mom to his, like, I guess, office or wherever they see patients, one of the rooms, and was telling her what it was. But yeah, because of that, he did his own research on what VEDS was, and he got me on a plan, referred me to a bunch of specialists, and he basically became like my dad, because he took care of me for 20 years.
King.
Yeah, super king.
Wow. When you said he wanted to do the skin sample and you said that he didn't mention what he was testing it for, did he already have an idea?
I think so. I don't think he thought of vascular type, which of VEDS, right? Of EDS. But I think he knew some type of idea. Like I definitely had some type of like collagen or connective tissue disorder. And he, at that time, the University of Washington was like the leading lab for diagnosing connective tissue disorders or problems with the collagen, which is like the body's glue. And so I think he just sent it over. I don't even know if he ordered a specific test. I don't know how it was at that time because it was 2004. But
Right.
they were able to study the cells of the skin sample and determine that they were abnormal due to the defect in the type 3 collagen, which is what VEDS is. So that's how I got diagnosed with the VEDS, is they were able to study the cells and determine that the DNA had a typo and it was producing my collagen wrong. Really interesting stuff that
Yeah.
takes a lot to understand it, but
I mean, to this day, some people don't fully understand it.
yeah, to this day. It's come a long way since
That's
then.
crazy.
With a rare diagnosis and, people not really understanding it, people with VEDS related conditions also get into situations, well, not get themselves, but they are in situations where doctors gaslight them or don't believe them. So on that topic, I wanted to share about a time that I was gaslit by a doctor. Back in 2018, I was in my first year? I had already done one semester of nursing school. And I don't know what, that year was just rough in 2018. I remember that back in February of that year, I was in the hospital for, I want to say intestine inflammation. I don't know. It was like 3 days maybe. And then it was just like from there, nothing was getting better for me. I couldn't eat. I didn't have an appetite, and then I think I would vomit. I don't know, or I would get abdominal pain. So I was literally sticking to like broths and green juice to try to like make my stomach feel better. And at that time, I was going in frequently to my hematologist's office clinic to get IV infusions, to basically get hydration, since I wasn't like eating normally, and to keep my body functioning well, especially for going through nursing school. And my hematologist referred me to a GI doctor, which my mom and I were pretty excited to go see because this GI doctor was actually researching Ehlers-Danlos syndrome and gastroparesis, which is when the stomach has delayed emptying into the intestines. So food stays longer in the stomach, and then, you don't get hungry. And that's a common complication for Ehlers-Danlos syndrome. Not so much VEDS, but I apparently was diagnosed with that. So when I saw the GI doctor, we're like, great, we're going to go see somebody who like understands, right? So we get to the appointment and he did some tests. Like he did a hydrogen breath test to see if I had any bacteria in my intestines, which was negative. He had me stop the medicine I was taking for gastroparesis, and he did another gastric emptying scan, and that actually came back normal. So I did not have gastroparesis, and I was taking meds all that time for it, but that's like a whole other story. And then they did a glucose breath test to see if, like, I guess if I'd eat anything high in glucose, it would trigger symptoms, and that was normal. But then they did a fructose breath test, which is another sugar, and that actually came back abnormal.
I remember.
We attributed like the constipation I was having, the diet problems, to that fructose malabsorption. And it made sense because I have to take Miralax daily to keep my intestines and stools moving so we don't have constipation, because the VED specialists suspect that if we have constipation, then that leads to a higher risk of perforation because, things get blocked and irritated, and yeah. And so I was taking the Miralax with apple juice, which is high in fructose, every day. So we figured out that was probably why I was not getting better. And the green juices that I would drink would have apple. And so we're finally, I was starting to feel better after that, but I was still constipated. And we were concerned about that. And the the GI doctor, when I brought up my concern of constipation to him. My mom was in the room with us. He was like, your intestines are strong. They're constantly pushing. And I was like, well, it's not normal for an 18-year-old to have a small bowel obstruction, which I had when I was 18. I had two of them. And he was like, we're all sitting on a bowel obstruction. He's like, I am, your mom is. He's like you could have one. And I was just like looking at him like, what the heck? Like, this dude does not understand the fragility of the ved's intestines, you know?
And when he said you have strong bowels, like, you literally don't.
No.
Did he knew you had veds, right?
Yeah.
Okay.
The problem, too, with the veds being grouped in with Ehlers-Danlos syndrome is that the most common type of Ehlers-Danlos syndrome is hypermobile, and they have very debilitating symptoms and a lot of like comorbidities, very it's a lot of problems that they go through, health problems, but it's not as life-threatening as a vascular type is. So I think that doctors see more of the more common type of Ehlers-Danlos syndrome, and that's the picture that they see instead of the more rarer types like VEDS or the classic type of Ehlers-Danlos syndrome. So that's probably what he's thinking, is he studied these other like types of EDS or other like connective tissue conditions, and he's like, you know, thinking that my mom and I are being like dramatic. He's like, you know, telling us that we shouldn't be concerned for perforation. But the kicker is that my colon actually perforated for the first time 3 months after seeing him. Even then, like, he was able to see my records in the hospital. He still didn't understand why I was following with a colorectal surgeon after my intestine perforated. So, funny story that I'll just kind of throw in there too is that my mom had kept pushing for me to see a colorectal surgeon, just to establish care with somebody in case something GI happens to me. We have somebody who knows my history. And at the surgeon that saw me in the hospital, I was actually scheduled to see the Monday after I was admitted for my perforation, which was on like a Thursday or a Friday.
Oh, wow. I didn't know that.
Yeah.
Surprise, shawty.
He was rounding and he ended up taking care of me, and I didn't have surgery, but you know, also just for people to learn that with VEDS, they wanted to wait until the inflammation calmed down and to see if the perforation would heal on its own before deciding whether or not to go in for surgery. So luckily at that time, like, everything healed on its own, and so I continued to follow up with him. But I got a voicemail from that GI doctor that I saw, and he was again going over the results from the test that he had ordered over the summer, which he had already told me, but I guess he forgot. I don't know. But then he says, I don't know why you're seeing a colorectal surgeon. Like, I don't know why you need to be seeing one. And I was just like,
my guy.
did you not see that my colon perforated? Like,
yeah.
It was weird. I obviously never went back to him, but I will say that GI doctors have been some of the harder ones for me to vibe with having VEDS. And I think that people in general have a hard time with GI doctors. I don't know what it is.
That is crazy.
I have one more story I could share with the GI doctor and gaslighting.
Oh, please.
I just remembered another one. So this was actually in a different city, and I went to him again just for management of constipation, somebody to be involved in my care. I don't remember if he was a surgeon or not, a GI surgeon. And GI, for people who don't know, also I should have said this a while ago, is gastrointestinal, so stomach, intestines, all that helps your digestive, all of that's involved in your digestive system. But anyways, I talked to him and he was telling me that I should get a colonoscopy, which with VEDS is risky because there's a risk of them nicking my intestine and it perforating. And so he didn't really understand that. And I told him, I actually know of one VEDS person who, I think they gave him or her an enema and the intestine perforated.
Oh my God.
This is not something I take lightly. I'm not 100% against it because I think in some cases it could be helpful.
Yeah.
You know, benefits against risks kind of thing. But I definitely am not going to get it done by a doctor who doesn't understand my fragility and who's going to find out once they go in there. That's not who I'm trying to have get this done, right? So I told him, and he's like, well, it's because, like, you got, you know, there's risks of cancer and it's just the standard of care. And I get it. That's the standard of care. But I know that my problems are because of Ed's, right? Like, and so I told him, I'm not completely against it, but I'm not ready for one.
Right.
And so he left the room, and the nurse comes in to like discharge me and give me the after visit summary, whatever. She hands me the instructions for a colonoscopy and the prescription for the medication to drink to clear out my intestines.
So he just put it in anyway.
Yeah.
Wow. You didn't do it, did you?
No, I never saw him again.
Wow. That is nuts.
It is.
And this was after.
This was after the first one. I was like, did you not listen to a word that I said?
Yeah.
Were you present in this room?
Why do you think it is that the doctor still went through with like pushing for the colonoscopy?
I don't know.
Like, is there a reason?
I think in some cases, like for him, he's talking about cancer risks. It's like kind of like saving their asses for liability purposes.
Okay.
Like if down the line I were to have cancer and, there would have been like a colonoscopy would have fixed this. So I can't go back and be like, well, no one recommended this to me because he at least tried that. But I was not appreciative of it being forced upon me.
Damn. That is crazy.
Yeah, we literally spent the whole visit talking about how I was not ready for one. And they still came in and told me to schedule it.
Wow.
And maybe there's miscommunication between him and the nurse. I don't know. So GI doctors are very hard to come by.
It sounds like it. Jeez. 2 for none.
Two GI doctors 2 and me 0.
I don't think I had heard that one before.
No?
Mm-mm.
Yeah, I feel like, I don't know, there's just so many that
They
I could
come
probably
in.
go on and on, yeah, for days.
Start making a list.
Yes. But also, we want to hear from you guys if you have any stories with gaslighting or taking a long time to get a diagnosis, and how did it make you feel? Like, what did it change anything for you? Did another doctor come in and save the day? We want to know these types of stories because we really want to push out there that healthcare professionals should listen to patients. Like literally, what is it what they say when listen instead of hearing?
Listen instead of hearing. Yeah, that makes sense.
Right? Like not just
listening.
Like not just taking in the sound of somebody's voice, but actually actively processing what they're saying.
Active listening.
Yes, active listening, empathetic ear.
Period.
Give us a follow on Instagram. I have Investigator as the main social media to promote Divas Who Listen, but we are also on Apple Podcasts, Spotify, and YouTube. So if you want to see our gorgeous diva faces, you can go to YouTube. Spotify and Apple Podcasts are audio only, which is our for sale. I guess that's it. Message us if you want to share a story. You could if you fill them out on the link that we have in the link tree. It is anonymous, but you could also just DM your story to Miranda, to myself, and then we can read it live. It won't be anonymous. We want to make you feel heard. We are your active listeners right here.
Yes. Send in your stories. We want to react, please. I love reacting. I've been practicing my faces.
Look at her. That was great.
Go watch it on YouTube so you can see my face.
Thank you all for listening. We hope you enjoyed episode 4, and we will return next month.
Bye, y'all.
Bye.